The federal government has been seizing orders of medical equipment that were supposed to go to various hospitals throughout the country. Now, there is a lack of transparency as to why this is happening. There's a lack of transparency when it comes to whether these hospitals will ever receive the supplies that they ordered themselves. But here's what we know so far, based on reporting from the Los Angeles Times and the New York Times. For instance, in Florida, a large medical system saw an order of thermometers taken away, and officials at a system in Massachusetts were unable to determine whether its order of masks went or where it went. Peace Health, a 10-hospital system in Washington, Oregon, and Alaska, had a shipment of testing supplies seized recently. So they make these orders. Obviously, right now, we're dealing with the federal government who has told states to fend for themselves, get the equipment and the medical supplies that you need on your own. Don't look to the federal government for any help. Don't look to our national stockpile because we're incompetent buffoons that didn't actually maintain and replenish that federal stockpile. And so hospitals are doing what they've been told to do. And then in the meantime, you have FEMA intercepting these deliveries and seizing the very medical supplies that these hospital administrators have ordered. In fact, Richard DiCarlo, who is the COO of Peace Health, was quoted as saying, "It's incredibly frustrating. We had put wheels in motion with testing and protective equipment to allow us to secure and protect our staff and our patients. When testing went off the table, we had to come up with a whole new plan." So you have all these hospital administrators who are adapting and they're doing what they can to deal with the situation that's in front of them, with this incompetent federal government and with this horrible pandemic. And then you have Trump basically telling FEMA to seize these shipments. Now, the lack of transparency is certainly an issue. Here's what we do know. Here's what FEMA has said. The Federal Emergency Management Agency is not publicly reporting the acquisitions, despite the outlay of millions of dollars of taxpayer money, nor has the administration detailed how it decides which supplies to seize and where to reroute them. Federal officials say they are trying to expedite the shipment to the United States of large quantities of medical supplies procured by private healthcare providers. But here's what really does concern me. FEMA allows those distributors to sell about half of the equipment to companies and counties that had previously placed orders. The other half of the shipments must be sold to counties that the federal government prioritizes by the severity of the outbreak, supposedly, based on data compiled by the CDC. Now, the reason why I say supposedly is because Donald Trump is the type of thin-skinned egomaniac that likes to retaliate against states that have not been overwhelmingly supportive of his presidency. So if he's seizing medical supplies that states have ordered, that doctors and hospitals have ordered, and he is making decisions as to where those supplies go, I'm very much concerned that those supplies are not going to end up going to the counties and the states that desperately need them, but they're going to end up going to places like Florida, for instance, where the governor has received 100% of the requests that he's made to the federal government because he's incredibly friendly to the Trump administration. That's the kind of stuff that I'm concerned about.
Yeah, and like under normal circumstances, we could be worried about incompetence and, bureaucracy getting in its own way. We've had disasters that the response has been mangled. And we've definitely had politicians where we worried that they were perhaps influenced by racial animus and bias, things like that, in their response to certain types of natural disasters. But the personal stuff in terms of Trump is like a new layer that I haven't really had to consider in past presidencies, where he is so clearly driven by his own personal political interest. As you pointed out, the thin-skinned way that he personalizes the relationship between the federal government and states and governors. And so with all of these moves, we have to worry, what are the FEMA heads being told? What contradictory information are they receiving from, for instance, potentially high-ranking medical experts on the one hand, and then people like Donald Trump or Jared Kushner or, whoever on the other? And it's a really terrible position to be in, where you look at these case counts go up day by day in different states and the death counts go up, and you just have to wonder, what if it wasn't Trump? What if it was someone else? Even if we were to bake in the horrifically slow response, let's say as of 2 weeks ago, Would Michigan have gotten more? Would California not have gotten a shipment of 100% broken ventilators, for instance? And New York in particular. Like it's a really terrible position to be in, where you have to worry that Donald Trump's personal anger, jealousy, or hatred towards individual politicians could result in people dying.
Absolutely. And just to provide a little bit of evidence that some states, some counties are being treated favorably by the Trump administration, the New York Times reported earlier this week that advisors to Jared Kushner have surprised FEMA officials in recent weeks to deploy supplies to communities after the area's representatives got through to Trump, even if the state had not yet gone through the formal process to secure supplies. So clearly, there are some stricter standards for certain parts of the country. But when it comes to local politicians who are nice to Trump, who have had conversations with Trump, they don't even have to go through the formal process in order to secure the medical supplies they need. And let me be clear about something. I think that every state, every county that requests these medical supplies should be able to get them, right? So I'm not saying, oh, we should hoard all of these supplies for blue states or blue counties. No. But what I am saying is that I do not trust the Trump administration to actually do an assessment that's fair and then determine where these supplies can go. One other thing that I'm concerned about, and everyone should be concerned about, is that Trump's administration has done nearly nothing when it comes to price gouging by private companies in the middle of this pandemic. And that's also disgusting. So there are people who are losing their lives right now. More than 14,000 Americans have already died because of the coronavirus. And Trump is playing political games because he doesn't care about their lives. He cares about his political career, and he cares about doing favors by people who have been willing to stroke his ego. And that's it.
Thanks for watching The Young Turks. Really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat emojis, badges. You've got emojis of me, Anna, John, JR. So those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.